Dr. Michael Ryan with Missouri Vein Care, and I'm talking today about should I get another opinion or a specialist opinion about my leg symptoms. And the short answer is most of the time I would say yes. Most of the time that likely would be a vein specialist, but it depends to some degree on your symptoms. And I can speak from my own experience as a practitioner. I see a lot of patients that come in, and the story I hear from many is that they've been suffering from a vein condition for years. Their legs are aching, throbbing. They don't quite know what the problem is. They talk to their primary care provider. They may go to a specialist, such an orthopedist or a pain specialist or others, and they never really get an answer, and they never really get a definitive yes. This is what your problem is, and this is what we can do to help you. And usually they're told this is something you're just going to have to live with. For people that have that problem and the leg pain and the symptoms and the fatigue, it is a very demoralizing and depressing uh, conclusion that they're coming to. There's nothing that can be done to help me. That's a terrible thing. And in fact, for most of those patients, there is something that can be done. So I without hesitation, recommend that individuals who have leg symptoms, aching, fatigue, cramps, swelling, restless legs, foot symptoms like burning, stinging, tingling, numbness, and also generalized fatigue, which can also lead to weight gain. Those can often be a symptom of an underlying vein condition that will significantly improve with treatment. The only way to get that sorted out is to get an evaluation with a vein care specialist, which includes a special um, ultrasound. The ultrasound shows whether the veins under the skin are working normally or not. That exam really has to be done standing up to show the abnormalities in the veins. And typically, a lot of centers will have an ultrasound that's looking for blood clots, which is done laying down. So the abnormalities are not identified. So with that ultrasound and an evaluation with a specialist, usually it's possible to sort out whether a vein condition is present and can benefit from treatment. So for those that have decided they want to get a second opinion to evaluate their leg symptoms, and as I mentioned, that's a very common scenario that I see. There is the issue of trying to get either approval or from your primary care doctor or a referral or just simply a self referral. How do you go about it? And for some people, and I would say that quite a few, there is a lot of hesitancy to approach their doctor because they've maybe already talked about it and their doctor is not acknowledged it, not giving them validation that their symptom is worthy of a specialty evaluation or a second opinion elsewhere. And so they sense that this is not going to be supported by their doctor, and they don't really want to ask for a referral. So one thing that people need to understand is that these days it's uncommon, not 100%, but it's uncommon for insurers to require that patients get a referral. Now, there are certain insurance plans where you have to get a referral for everything, but very often you can get a self referral. And the best way to approach that is to, if you feel like you want to get referred to a specialist, call that office and say, I want to refer myself. Do you need a referral from my doctor? And I would also say, I wouldn't, if you're concerned about communicating with your doctor about what you're doing, I would not give your doctor's name to them and say, I don't want to give you my doctor's name, but I want to know, do I need to get a referral? Here's my insurance information. And they will be able to do some research and tell you whether you need a referral from your doctor or not. If you do need a referral from your doctor, there's no way around that. And you'll have to bring that up with them directly. You may want to approach their nurse. They often will be a little more diplomatic about it and also help facilitate it and be your advocate as the doctors are busy, distracted, etc. Often a nurse will actually listen and hear that you really do want to get some help and get an evaluation. So it's a delicate uh, interaction with your doctor. You want to make sure you're in good terms with them. You don't want to cause upset feelings, but you need to find out what's going on. So it's something that really does need to be addressed and often can be without requiring a referral from him, or you can get help from his nurse to get the referral. So Dr. Michael Ryan talking about should I get a second opinion about my leg symptoms?